Hi there, this is Town of Islip Supervisor Angie Carpenter, and joining me today with Supervisor Spotlight, joining me today is Dr. Chris Raio from Good Samaritan Hospital. He is head of emergency medicine with Good Sam and Catholic Health Services. And Chris has been a guest many times, and I thank you for being so gracious with your time.
Thank you for having me.
These have been challenging times on a person's time and psyche and everything else, but you've been so gracious and we appreciate it. And over the last couple of weeks, I guess it is, we've started to see the numbers starting to go up, and obviously we're concerned and thought it would be a good time to bring you back and do a little bit of a recap.
Review.
And so you're on the front lines. What are you seeing? Tell us.
So we're definitely seeing an increase. I would say over the last maybe 10 to 12 days in the hospitals across CHS, and I also communicate with colleagues in other health systems locally and nationally. We are starting to see an uptick in cases. I would say it's not as drastic of a, an acute change that all of a sudden one day we're getting a ton of patients. It's been definitely more of a slow surge, and on the positive side, it doesn't seem like yet we are seeing the really sick patients come in large numbers. So the patients, I think, are probably coming in a little bit earlier, so they're not really reaching that point. There's a lot of other theories behind why the patients aren't as sick. Is it possible that the virus is a little bit different right now? Did it mutate a little bit? I don't think anybody knows that for sure. There's some theory that maybe the virus is affecting different demographics. So perhaps it's not affecting those, lower income, high density population areas, although some of the data goes against that.
Yeah, contradicts that for sure.
I don't really know. I think personally that people are probably coming in a little bit earlier. And also I think 100% we're a lot more knowledgeable in how to treat the virus and, the patients who contract it. So I think that absolutely we're definitely better prepared.
Yeah. And that's funny because I was going to ask that very question. Has what we've been through, or you guys have been through on the front lines in the hospital during the pandemic so far, changed the way you've done things and kind of prepare you better for what might be coming?
Yeah, I think during that first surge, it was a lot of idea sharing and trial and error. But I think, within CHS and elsewhere, I think we now have our processes down a lot better. That we're very strict about our protocols. Everything is geared towards the safety of our staff, the patients who could have COVID or do have COVID, and also those patients who don't have COVID. So, we have processes in place to separate the patients as best as possible, obviously appropriate PPE, distancing, hygiene, etc. And I just think everybody's a lot more comfortable, a lot more calm because, we've been through a major surge. And I think that we're much better prepared today.
Well, that hopefully will give everyone, a little bit more comfort and confidence as we move forward and prepare. And hopefully, the last couple of weeks on the briefing calls that we've had with the governor's office, they've talked about that the surge that we're seeing, their feeling is that it's because of Halloween and parties and, more, get-togethers and people putting themselves in a position of perhaps getting COVID. So with Thanksgiving coming and holidays, I know that the governor has issued the, I don't want to say rule because we're not quite sure how it's going to be enforced, but no more than 10 people in a household, for a get-together.
Yeah, so I think Thanksgiving is certainly concerning. I think as much as possible we have to follow the governor's guidance. We also heard this a lot back with Labor Day, Memorial, that there would be spikes. I think it was a very different time. I think the concerning thing about Thanksgiving is it's predominantly indoors.
Exactly.
So unless we get really lucky on Thursday with a super, super warm day, it is certainly a risk, I think. I think there are things people can do. I think as much as possible, celebrate with your family that you live with. If
you mask.
Wear your mask, social distancing.
Yeah.
Try to stay away from those high touch areas. So the kitchen is obviously a very popular place on Thanksgiving, but try not to have everybody in there. Have your own utensils, own glass, use it once. Any single-use items, salad dressing, for example, if you could have that. And maybe have one person do all the serving so that you're not, passing the stuffing around the table and having everybody touch things. If you are going to get together with extra people, I think you have to try to be as safe as possible and do some of those things.
And everybody wants to be with family, and we certainly do, and 2020 has been a challenging year. But we want to be around for 2021 and
absolutely.
the years after, and maybe
and windows open would be the other big thing.
Yeah.
Try to keep that air circulating. You might not be outside, but that could be helpful as well.
We had a training session here in town boardroom today, and we had the windows opened, and the chairs were spread like 10 feet apart. We didn't have that many people, but spread apart, and someone came in and asked, are they going to have to keep masks on? And I said, yes, even though they were more than 6 feet apart, but you just can't be too careful. And one of the first women that came in went over and started closing the window, and I'm going, no.
Right.
The window has to stay open. So, wear a sweater, but, keep that air moving, because that really, really does help.
Yeah, hopefully we'll get lucky with the weather, but, you might have to deal with a little bit of cold to keep that air circulating.
But, we've got Thanksgiving, but on its heels is Hanukkah and Christmas and New Year's and all of the times when people, want to be with family and get together.
Yeah,
so.
I think that's the risk coming up, and why everybody's so concerned is, this time of year, everybody's inside, and, the summer, everybody was outside, so that's, already a little bit safer. So I think people just have to continue to be smart, continue to wear a mask, continue to socially distance, and we have to sort of get through it.
It's interesting. You watch the dynamics of human nature, and I find that people are being respectful of one another for the most part. The times that I do have to go into the supermarket, I, certainly always have the mask, and I don't think I've been in there that I've seen a person without a mask on. And the supermarket has the aisles going in one direction, and it is a bit of a pain in the neck, but you do get those extra steps in every day. But I see people kind of backing off. If someone's coming toward them, they kind of hesitate and let you pass and are keeping that distance. And so to your point, I think people are trying. They really are.
Yeah, I think everybody's trying, and I think we've done a fairly good job. We just have to keep the foot on the gas, because we're certainly not through this. In the hospitals across Long Island, we're seeing the cases definitely increase. It's nothing like what it was, but we don't want to get back there, right? We want to.
That's a good point.
Yeah,
it doesn't mean we can't get there.
Right. We want to keep it, where we're at now, and start to see the curve go in the opposite direction.
Well, we are going to take a little break here, and I want to thank again Chris Raio for being here, and we're back in a few moments.
You are watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. I'm Angie Carpenter, Town of Islip Supervisor, and absolutely delighted to have with us today Dr. Chris Raio, who's Head of Emergency Medicine at Good Samaritan Hospital in West Islip, part of Catholic Health Services. And, you've been on the front lines now for months with COVID-19, and we thought we'd have a little bit of an update on what is happening and all. But we were chatting offline a little bit about how life is so different and the protocols that are in place now that we never a year ago would have thought about this. You know, if you're on Facebook and a memory pops up and there's a picture of a group and they're hugging one another and, you know, like, oh my gosh, who knew?
Yeah,
who knew?
It's certainly a different time, I think. You know, that we'll learn some good lessons from this that I think will help in the future as well. So I think that's a positive. But, you know, I think most people want to get back to a little bit more sense of normalcy, and I think we'll be there, but I don't think we're there yet. I think it's going to be a 12 to 14, 18-month process.
I think that sense of normalcy is a new normal, you know, a new normal. I earlier was accompanying my husband to a doctor appointment, and of course you check in, they take your temperature before you can go into the office, and, you know, all of these protocols in place. And I found it interesting too, I had to make a dental appointment, and they were requiring a COVID test in the office before.
Right.
They were doing the, you know, rapid test.
I mean, it's good to see, though, right? It's good to see that people are addressing the problem, not just shutting down, but really trying to make things safe for everyone.
And even at Town Hall here, initially when the governor issued the 50% working from home, you know, for those that could, we were able to do that to a certain degree. It certainly was difficult, but when everyone was coming back to working in the buildings, developing that protocol. And to this day, you know, when I come in the morning, there's the temperature check, and, you know, people are wearing their masks. Certainly when you're sitting at your desk and you're not, you know, more than 6 feet from someone, they are taking their masks off. But when someone walks in your office or into your space, the masks go on, and people really are trying. Yeah,
I think the mask is just a part of people's routine now. I think, you know, I don't think that that's bothering people, you know, too much for the most part anymore.
I was talking to someone in education just the other day, and he was saying to me that the kids are really, really good about it.
Yeah, it's surprising.
There's more of a problem with adults, you know, in a school settings per se, keeping their masks on as they're supposed to, but the kids are keeping them on.
Yeah, I think most of us with kids were a little hesitant that the mask thing in school would actually work. But you know, they put them on. They go either in the car or on the bus, and I haven't heard of issues related to mask wearing.
It's really
in the schools.
My grandson's 7, and I would think that would be an age that they could be a little bit, you know, I don't want to wear this, but never a problem.
I think they understand more than we think, too. I think, you know, if you communicate with them, they actually get it.
And they're like little sponges. I mean, the radio's on, the TV's on, they're hearing all of this.
Yeah.
You know, parents are talking about it, they're absorbing it, and they know. Like you said, they know more than we give them credit for sometimes.
Absolutely.
But, and, you know, thinking about or talking about kids brings me to another issue that I want to talk to you about, and that is, you know, a kid's psyche. What is going on? You know, it's so different from what it should be or what it always was. Going to school every day. Now, maybe they're not. Maybe they're going 2 times a week. You know, virtual from home, sitting there with the computer. No socialization. You know, what is the long-term impact of that going to be?
Yeah, I think that's a good point, not only for the kids, but for adults. I think, you know, the elderly, those with comorbid conditions who are staying home more, you know, I think there's a huge impact on those people as well. And I think that's why it makes it so important to put the safety protocols in place like you talked about, but, you know, try to open as much as possible and just be safe about it. Because, you know, one of the things back to the hospital scenario is that we are seeing a lot of patients come in at much later points in their disease course than we had pre-COVID. So people with, you know, appendicitis, let's say, or other types of infections who normally would have come in on day 1, you know, the minute they had a little bit of pain, now they're waiting. And we're seeing, in some cases, worse outcomes for these people because of that. And I think it's a very, very important message that people get in the community that hospitals are safe right now. I honestly do not think I know of any case of a patient coming in without COVID who then got it from being there. There's a lot of safety protocols in place. There's processes to keep patients separate, and if they have a need to see a healthcare provider, either hospital or outpatient, their own doctor's office, they need to reach out because waiting could be a bad situation.
And even too, let's take it another step to the preventative care. Not just when you get an ache or pain and ignoring it because you don't want to go because you're afraid you're going to get COVID, but the kinds of things we need to do routinely, whether it's the dentist, the periodontist, the eye exam, the dermatologist, the kind of routine things that you do that, it's time for another appointment, and you try to find a reason to put it off. And, I'll tell you from my perspective, it happened. I was set for a routine visit with the periodontist, and COVID hit. Okay, I guess I can't go.
Yeah.
And then that 1 month got to 3, whatever. And when I finally, called a couple of weeks ago to make an appointment, realized it had been over a year. And but the protocols are in place. It is safe.
Yeah, I think we're at the point now where the healthcare environment is safe.
Probably safer than it ever was.
It might be, yeah.
Right?
We're all wearing the appropriate PPE.
Right.
Hand washing is at the top of everybody's list. And it's really critical that if people need any type of healthcare, that they reach out and go get it.
Even in a doctor's waiting room, you see seats marked off, don't sit here, helping people with that awareness and keeping their distance.
Yeah, it goes also not just for the true medicine part, but the psychosocial issues that people may be having as well. I think, that's a patient population that is potentially could really suffer, those with behavioral health issues, and it's important that they get care now as well.
Oh, absolutely. And I think the last couple of years we've made tremendous strides in having people accept and understand that your mental health is as important as,
Absolutely.
your oral health or, any other part of your body. And with COVID, there certainly have been a lot more stresses in people's lives. And when I talked earlier about young people, I worry about that. You see they're not necessarily being with friends because they're confined to, that.
Yeah, I think different kids, I even see it with kids, friends of my children, they definitely reacted a little bit differently. But they're resilient. Kids are pretty.
That's true.
And I think, if they'll get through it, hopefully. But again, they need anyone who needs any kind of care. They need to seek it out.
Yeah, it's safe.
Yeah,
it's safe.
Absolutely.
Speaking of safe, we want to be safe, and traditionally this is the time of the year when we will start talking about the flu. And I've sort of been at a couple of events, socially distanced, but I've put people on the spot. I was at a press conference the other day and talking about, COVID and how important it was to get your flu shot this season.
Absolutely.
That the last thing you want is flu and COVID. And, just, okay, a show of hands who've gotten their flu vaccine, and people are like, okay.
So, the flu is a little tricky, honestly. Every year there's predictions, we're going to have a bad flu season, this isn't going to be too terrible.
Hold that thought, because we're going to take a break, and we'll come back with Dr. Chris Raio and talk about the flu.
You're watching ITV, Channel 18, Islip Television.
Hi there, it's Angie Carpenter, Town of Islip Supervisor, and welcome back to our final segment on Supervisor Spotlight. And our guest today is Dr. Chris Raio, who heads up emergency medicine at Good Samaritan Hospital, part of Catholic Health Services, and doing an absolutely extraordinary job.
Thank you.
This has, been trying times for all, and despite that, life goes on. You know, the hospital keeps chugging along, and you know, the doctors are doing what they need to do, and not just the doctors, obviously the nurses and everyone that's part of the healthcare system. I think rightly so, for the first time in my lifetime, I can remember that we're seeing them recognized for, you know, life's, you know, they're doing God's work every day.
Yeah, I mean, we have a great team certainly at Good Sam, as do a lot of the other hospitals in the local region, but everybody really stepped up. I mean, I don't think I've heard of anyone who hasn't really stepped up to the plate and gone above and beyond to help treat the patients who are coming in.
Yeah, it's been great. It really has been great. You know, before we took the break, we talked a little bit about the flu season upon us and how important it is to get your flu vaccine. And it's an annual thing, and talk a little bit about why.
Yeah, so
we
you know, we never really know how bad a flu season is going to be. I think this year it's particularly important that if you should be vaccinated, that you do so. I also think that these things here, this distance here, washing hands, you know, if I had to predict, I would say it's going to help big time. We are seeing some cases. But we certainly have not gotten hit hard by a bad flu season yet.
Yeah. So, you know, these little strategies, the washing of the hands and the sanitizing and the 6 feet and everything that we're kind of drumming into everybody to do really, really does work.
Yeah, and it's going to work for not just the flu, all viral illnesses, really. I mean,
so let's talk. We mentioned the word vaccine, and that certainly has been in the news lately with the companies that have you know, develop the vaccine.
Yeah, so I think, you know, when people see that the vaccine trials so far have been successful, it's great. I think, you know, I'm excited about it as well.
95%'s got to be huge.
Yeah, but I think people also need to take a step back and realize that it's unlikely that everyone's going to be vaccinated anytime before maybe next summer, and that's probably a little optimistic. So, you know, the time frames that I'm hearing are that healthcare workers, frontline workers, possibly first quarter of next year, if things go well. And then, you know, the general population will be sometime after that. So, you know, optimistically, we're still probably 7-8 months out from, and then who is going to actually get vaccinated and who isn't, you know, that's an unknown as well.
But I think, unlike the last time we met, which is now a couple of months ago, there's kind of a light at the end of the tunnel.
Oh, yeah.
You know, the fact that the vaccine has been developed, that it has shown to be very, very effective, that there's even, you know, today or yesterday I heard about the at-home kit being approved by the FDA by prescription only. But these strides that have taken place, at least we can be hopeful.
Yeah, so I think the vaccine is a huge plus. I think all of the treatments, therapies, how we're taking care of these patients has gotten much, much better. We've certainly learned a lot. You talked about the at-home molecular testing, which, as you said, is going to be by prescription. We're hoping to see that early next year. That coupled with, I think there's, you know, the strides in testing are really incredible. From the day when this thing hit, where it was really, really hard to get a test on a lot of people, even if they were symptomatic at times, to the point where we're at now, we're way ahead of the curve. So I think all those things are really, really helping us today.
You know, when you talk about testing, just yesterday we opened a test site here in the town of Islip, in the hamlet of Brentwood, which has had an inordinately high amount of cases. Out of the 16,000 cases, reported COVID cases in the county of Suffolk, 5,000 alone are from the hamlet of Brentwood. And because of that, I've just felt for such a long time, we did have a testing site there early on. It was up for maybe 6 weeks or so. I think that went through the state and the county, and then that was taken down. And, you know, I really just have been pushing, thinking that we really should have a testing site there. So Good Samaritan Hospital, because of a grant that we were able to secure through our Town of Islip Community Development Agency, and I really can't thank the director, Jay Bowers, Julie McGibbon, the people at the CDA and the volunteer board who had to ultimately vote to appropriate that funding because they had gotten federal funding. And Good Samaritan Hospital stepped right up and said they would set up the test site. So yesterday was the first day of testing, and we had really not done a tremendous amount of outreach or advertising on it.
Right.
Yet out of the 50 tests that could have been administered yesterday, they did 49. Yeah. And so they'll be there Monday, Wednesdays, and Fridays from 1 o'clock to 5 o'clock by appointment only. And that number is 631-376-4444. Just call, tell them that you want to book a test at the Brentwood testing site. It is free. And, you know, Good Sam's been great.
Yeah, I mean, I think that project is unbelievable. I think there's a huge need, and I think you addressed it, and I know the team at Good Sam that's working on it has done a phenomenal job. They said the process was very smooth and successful.
I mean, there was no trial run. I mean, the tent, you know, the board voted to appropriate that funding on Thursday. Friday morning, our Parks and DPW guys were up there setting up the tent. Yeah. And fortunately, the town had a tent, so that was wonderful. That the money that would have been expended on erecting and you know setting up a tent for those that hopefully it'll be about 3 or 4 months. Yeah. Wouldn't it be wonderful if the numbers just dropped?
Yeah, I mean, it's a needed resource that you addressed, and I know the Good Sam team is super excited to participate.
Yeah. So, but there are, like you said, so many more places now that you can go for testing. At Long Island MacArthur Airport, we have American Family Centers, AFC, setting up testing appointments as people come off the plane, because the new guidelines are saying that if you don't want to quarantine for 14 days, you can get a test on the 4th day after 3 days of quarantine arriving into New York. So the healthcare personnel from AFC are going to be at the airport and answering all of the questions and enabling people to book those appointments right away.
Yeah, I mean, all the testing that's going on is just going to help us to identify, you know, potential sources of risk and hopefully slow down the spread as much as possible. And any process where we can test more is a good process. Yeah.
And also, too, this testing site is going to give us the opportunity to do outreach into the community, you know, repeating the necessary protocol if you do have the symptoms, if you do think you may have it, to quarantine until you can be tested. And
yeah, I mean, I think that education is critical, and we just need to continue delivering the message. Yeah. We were talking earlier about you know, a COVID fatigue. And I think people really need, now's the time to get over that, because with the winter coming, we just have to be a little more cautious.
Just have to be on our guard, you know.
Absolutely.
And to that point, I got a call today from the chief of the department, Suffolk County Police Department, Stu Cameron, and during the height of the pandemic, I had asked him if he would do a message about wearing your mask and how important it was. I said, you standing there in your uniform, you know, kind of authoritative, and how important it is. And he did do it. So he calls me today and he goes, you know, with the upcoming holiday season and maybe people being a little lax, we were thinking of doing another video. Would you be willing to run it on ITV? I said, absolutely, you know. So he sent it over to me, and obviously it was great. He does a great job. But I did ask him if he would please do it in Spanish too. So if you're watching ITV now, you'll be seeing Stu Cameron urging you to wear your mask throughout this holiday season. And hopefully, you know, after the winter, we'll be through the worst of it and looking at brighter days. But Dr. Raio, Chris, I can't thank you enough for coming back.
Thanks for having me anytime.
As always, it goes too quickly. And please keep in touch, and please stay safe.
We will.
You know, being on the front lines as you are.
Thank you.
We worry about you too.
Thanks.
So I hope you and your family have a wonderful Thanksgiving. And to everyone out there watching, please wear your mask, be careful, stay healthy. We're in this together, just 6 feet apart.